Hello, my name is Dr. J. Michael Bennett. I am a member of the Fondren Orthopedic Group, and I am a sports medicine specialist that specializes in injuries of the shoulder and elbow and knee. Today we're going to do 5 shoulder pathologies within 5 minutes. So I'm going to try to cover as much as I can within these 5 topics. And if you have any further questions or any want to look into this further, please go to our website. So many patients come to our office complaining of general shoulder pain. Most of the time shoulder pain can occur in different areas of the shoulder. Most people usually describe it as occurring right here in the mid-humerus region. A lot of people actually think that's not necessarily shoulder because it's a little bit lower than where the shoulder is. A lot of times it's referred pain. You may have an issue with the rotator cuff, you may have an issue with the bursa, and that oftentimes refers the pain down to about mid-shaft of the humerus here. So one of the first big or most common issues that we see in the shoulder is something called bursitis and impingement. And this can come about just very subtly. Sometimes it can be though we sleep at night, sometimes it can have to do with doing a lot of repetitive activity. But what it looks like is when you look at the shoulder joint, you've got the ball and the socket of the shoulder joint, and these are your bones in the joint. Above that ball and socket, you've got your acromion and the clavicle. So those are the roof of the joint, and then you've got the rotator cuff right in between. This is in green right here. Between the rotator cuff muscle and tendon, which is in green, you've got a little space here, okay? That little space is a little fluid sac, and it's called the bursa. That bursa is normal. It allows you to have mobility and allows that tendon to glide underneath these bones. Sometimes that bursa gets really inflamed and thickened, and when that happens, you get a bad bursitis, and it gets thickened and inflamed and becomes very painful, particularly with certain motion. Most people will have full motion and decent motion, but they'll have pain when they lift it at about 90 degrees and above. And that's when that bursa gets pinched. And what I mean by that, when this shoulder rotates upward like this bone rotates underneath this little roof here, and it pinches that little bursa. And it actually also pinches the tendon, and that becomes painful. And that's what we call bursitis, and we call that also impingement syndrome. Because sometimes you can also have a little bone spur here that can contribute to irritating that bursa as well. So that is number 1.